5 ways to save more on health expenses. 1. Regular checkups and screenings. Taking advantage of preventative care can be a way to save on health expenses. By regularly visiting a primary care physician for checkups and screenings, potential health issues can be caught early on, when they are often easier and less expensive to treat. Preventative care can also help identify potential health risks and help you make lifestyle changes to lower the risk of developing certain conditions. Regular checkups and screenings can include physical exams, mammograms, colon cancer screenings, and cholesterol tests. Additionally, many insurance plans cover preventative care services at no cost to the patient. It's important to note that preventative care is not only important for physical health, but also for mental health. Regular checkups can also include screenings for mental health conditions, such as depression and anxiety, which can be treated more effectively when identified early. 2. Network providers. Using in-network providers can be a way to save on health expenses. When you use providers that are in-network for your insurance plan, you will generally pay less out of pocket than if you use providers that are out of network. Health insurance plans have networks of providers that have agreed to accept a lower rate for their services in exchange for more patients. When you use in-network providers, you typically pay less for deductibles, co-pays, and co-insurance. Additionally, many insurance plans will not cover out-of-network care or will only cover a portion of the cost, which can make the care much more expensive. It's important to check with your insurance plan to see which providers are in network, and to make sure that the providers you use are in network. Many insurance plans have online directories that list in-network providers, and you can also call the customer service number on the back of your insurance card for more information. Additionally, it's important to note that even if a hospital is in network, not all the doctors in that hospital may be in network, so it's important to check with the insurance plan to confirm. 3. Compare prices. Comparing prices for medications and medical procedures among different providers can be a way to save on health expenses. Prices for the same medications and medical procedures can vary greatly among different providers, so it's important to shop around to find the best deal. For prescription medications, you can compare prices at different pharmacies, both online and offline. Some pharmacies offer discounts or generic alternatives, which can save you money. Additionally, you can also check prices for medications with your insurance plan to see if there are any lower-cost alternatives available. For medical procedures, you can also compare prices among different providers such as hospitals, clinics, and even with ambulatory surgery centers. Prices can vary widely depending on the facility, location, and the type of procedure. It's important to keep in mind that when comparing prices, you should also consider the quality of care, as the cheapest option may not always be the best option. Additionally, you should also check with your insurance plan to see if a specific provider or procedure is covered, and if there are any out-of-pocket costs associated with it. 4. Generic medications. Using generic medications can be a way to save on health expenses. Generic medications are copies of brand-name drugs that have the same dosage, intended use, effects, and side effects, but are usually sold at a lower cost. This is because the manufacturers of generic drugs do not have to repeat the clinical trials that the brand-name manufacturers did to prove safety and efficacy. Generic medications can be up to 85% cheaper than their brand-name counterparts, and are often just as effective. Many insurance plans also have a lower copay for generic medications compared to brand-name drugs. It's important to note that not all brand-name drugs have generic alternatives, and some medications may not be available in generic form. Additionally, it's important to check with your doctor and pharmacist to ensure that a generic medication is safe and appropriate for you, and to ensure that the generic medication is made by a reputable manufacturer. 5. Telemedicine. Using telemedicine can be a way to save on health expenses. Telemedicine is the use of technology, such as video conferencing and remote monitoring, to provide health care services remotely. This can include virtual consultations with a doctor, remote monitoring of vital signs and medical conditions, and virtual follow-up appointments. Using telemedicine can save on transportation costs and copays, as patients do not need to physically visit a doctor's office. Additionally, telemedicine can increase access to medical care for people who live in rural or remote areas, or for those with mobility issues. It's important to note that not all medical conditions can be treated through telemedicine, and some conditions may require in-person visits. Additionally, telemedicine is still a relatively new field, and the availability of telemedicine services may vary depending on location and insurance coverage. It's important to check with your insurance plan and primary care physician to see what telemedicine services are covered and available for you.